Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on June the 2nd, 2021. Key news in the hospital is that we do not have any patients who are actively COVID positive. We've had ones and twos over the last week or so, but today we have none. I'm happy to say there are a couple of patients who are still in hospital because of COVID and have been in more than 14 days. So we don't think they are infectious with COVID, but they're still here because of it. That situation contrasts a little bit with hospitals not far away from us. So we know that over in Blackburn with Darwin, for example, there are very poorly patients in critical care because of COVID. And it's that constant reminder to us that although our data looks good now, we need to remain ever so vigilant. Happy to report though that we haven't had any COVID related deaths either in the hospital for over a month now, which is obviously great news. If we look at the community data, we're seeing 19 per 100,000 for Wyre, 37 per 100,000 for Blackpool and 83 per 100,000 for Fylde. So those numbers are creeping up a wee bit, aren't they? And again, we need to be careful. Let me contrast that with the numbers for Blackburn with Darwin though today, which are showing 436 per 100,000. So it shows how quickly these things can escalate and change if we don't remain very careful about things. What we do know, which is good news, is that the variant that is causing concern, which was previously called the Indian variant, it's also known as variant B1.617.2 and is now really called the Delta variant. So I think that's what we will all see in the media. We can see that 2 doses of the vaccinations that are being used across the UK are highly effective against it. So the key message remains to get vaccinated, and to get both vaccines. So if anybody's umming and ahhing about the second one, please get on and get that done. The age group, of course, is progressively coming down. We're coming down into the high 20s now. We put a link on the cast last week. We'll do the same again about our ability to immunise people here, but the usual channel still exists through general practice and accessing through NHS services, through 1119 or through the website. So the message is for everybody, friends and family and so on, please get vaccinated, get that course completed. We've done about 33,000 vaccinations in the hospital so far, but of course those vaccinations are going on all across the system. Because the numbers are moving around, testing is very important still. There's plenty of testing capacity. You can, of course, get access to lateral flow tests as well, so you can get the tests and do them yourselves. So if you need to access testing, again, 119 or the NHS Choices website would be really helpful. So that's kind of the picture as far as COVID is concerned. I think the striking thing for us from a hospital perspective is that as those numbers have come right down, the hospital has got busier and busier. Some of that is entirely planned, and that's what we want to do in terms of working our way through elective surgery and so on. But our emergency department has been extraordinarily busy, unprecedentedly busy really. And last night we had as many as 90 people in the department right up into the late hours of the evening. So we've got to keep reiterating the messages about how to use our urgent and emergency services responsibly, because if these services become overwhelmed, of course, they put people at risk in other ways. So it's the usual messages around thinking about self-care, seeking advice from community pharmacies, seeking advice from primary care and general practice, using NHS 111, not only for advice, but in a sense about guidance of where to go if there's a problem. But of course, if there is a life-threatening emergency, then we must all use the 999 services. That's what they're there for. This week is Volunteers Week, and it's been lovely to see our Tangerine volunteers back in the hospital, helping people move around and supporting everybody. So I want to put out a big thank you to all of our volunteers who, frankly, we've missed through lockdown, and it's really lovely to welcome them back. So thank you to all of them. And lastly, a thank you to Elaine Smith, who's the chair of Friends of Stanley Park, for supporting the unveiling of a plaque yesterday, which the Friends of Stanley Park have kindly put together to honour all NHS staff who have been involved both during the pandemic, but really through all of the work that everybody does. So it was really a lovely moment for myself and Peter Murphy, who's the Director of Nursing, to go over into the park and unveil the plaque. So I hope everyone will get a chance to go and have a look at that at some point. So finally, keep doing all the right things in terms of maintaining social distancing, wearing our masks in enclosed spaces, and encouraging everyone to get vaccinated. Thank you.